We are back, and we are joined now by Joel Thornton, professor of atmospheric science at the University of Washington, here to talk about the latest reports on air quality throughout the globe. Joel, thanks so much for coming on the show.
My pleasure.
So there was this new report from IQAir, which is this Swiss air quality organization, but they are, I mean, can you tell us what IQAir is and kind of, I guess, why their findings are so significant?
So their IQAir is a company that sells a range of products, one to measure air quality, but also filtration devices to improve air quality indoors and prevent exposure to air pollution. And so as part of that effort, in their business, I think they are interested in making sure there's awareness around the issue of air pollution. And so they have been creating these reports which harness data from both sort of traditional government sensors that are deployed around the world in various countries for monitoring air pollution, as well as the private low-cost sensors, they're often called. These are like purple air sensors that you can purchase online, or you can purchase one from IQAir and put it outside your house, and then have a monitor of what air pollution is nearby your own location. And so these are often then connected to the internet, and the data can be grabbed by anyone. And that's what IQAir is doing, is sort of collecting all of this data and then analyzing that data into this report. And they work with government agencies around the world as well to obtain the data, which is not always easy to obtain directly from websites. And then sorry, go ahead.
No, just to clarify, so even though there's a profit incentive for them, this is governmental data, and we don't need to be skeptical.
Some is governmental data, but some are just from these sensors that people have purchased and put on at their home, and the data gets streamed to a website, and then that can be collected. So there is some need for skepticism around some of the, just in part because these sensors are not going to be curated or properly calibrated necessarily, and some will have various quality, and I'm not going to sort of disparage any particular company's devices, but skepticism is definitely required for especially individual sensors that you might go see on their website, like the IQAir is sort of posting all of the sensor data at in real time. And it's helpful to be able to see that, and because many of these devices do work reasonably well to give you a broad picture of what air pollution is like in any particular area. But if you try to focus in on one particular sensor, you may run into trouble for sure. And so in some cases, they are using data from one sensor to sort of describe what air pollution is in a particular location, and that can be problematic.
Okay, that's great context. I appreciate that. Because it wasn't necessarily immediately clear that it was a for-profit company in a lot of these articles about the findings. But it seems, though, that the findings can still be, they're still very much in keeping, I would say, from other reports that I have heard about declining air quality standards globally. I mean, as a professor of atmospheric science, what have the past few years been like in terms of global air quality? And if you could describe that within the context of the traditional standard, which is the WHO standard of measurement.
Right. So it's sort of two-sided problem where in many regions of the world, advances are being made because of regulations imposed on industry, and energy production and so on, that pollution has been decreasing. And that's certainly the case in the United States, North America, Europe, China, India. There are improvements to air quality in many of these regions, especially from pollution that was directly driven by human activities, so related to transportation, to driving your car, or energy production like coal-fired power plants. The regulations have been getting tighter and tighter, and so air pollution has actually been decreasing in many of these areas. The problem over the past few years has been wildfires, especially in North America, but also throughout the world. both sometimes intentional burning, but also wildfires, especially in North America, have grown in frequency and severity. And in many places, this is actually wiping out the improvements that have been made through regulations that are tightening emissions from other sectors that we can control. And so in some ways, things are improving and also getting worse at the same time. And there's this intersection with climate change because as the Earth is warming from increasing carbon dioxide, this is basically driving ecosystems to be more drought stressed more often and or for longer periods, priming them for when they do burn for more energetic and larger burns and longer burning seasons. And this is then increasing the amount of particulate pollution, but also other types of pollutants into the atmosphere in very large quantities in very short time periods. And so you end up getting these very extreme events of degraded air quality, like was experienced throughout the US and Canada, for example, this past year. And that event actually led to a lot of what was in the report. The findings of the report for where some of the regions had the worst air quality was often driven by these wildfires.
So yeah, if you could speak a bit about that, the effect that these wildfires, if over the summer, had on 2023 air quality levels in North America. We're here in Brooklyn. We all remember walking around wearing masks. It was a little bit different for us, which I know people in the western part of the United States, it's a little bit more quotidian. But for us, it was a scary event and something that I hadn't necessarily experienced yet. What were the results? What did the science show that these wildfires had on air quality in North America?
So it was, by any measure, an extreme event compared to the past 2 or 3 decades of monitoring of air pollution, especially on the East Coast. As you mentioned, the Western states are a little bit more used to, unfortunately, having to experience wildfire smoke inundating urban areas. And the statistics show that in the Western United States, in fact, the trend has been declining air pollution, but now in the past 10 years, that's actually flattened out and in some cases started to increase again. And that's being attributed to increased wildfire frequency and severity. It was a somewhat unique event that impacted the East Coast, that wildfire smoke can be transported and has been transported in years past all the way across from the Western United States or northern Canada into the East Coast. But the size and the intensity of the fire, so the area burned and the amount of material put into the atmosphere from the Canadian wildfires was factor 10 more than typical. And so that's partly why it was such an extreme event for this particular year. Wildfire smoke does propagate, every year from where the fires are, usually in the Mountain West, to different parts of the U.S. It's just that the levels tend to be lower and less discernible to us when we're out and about. But the extreme burning that happened in Canada this summer was obviously, you couldn't ignore it. The skies turned this bleak orange-gray during the daytime, and you could smell it. You could smell the smoke, and so you didn't need an air pollution monitor that worked very well to tell you that it was really dirty air. And so these, just to give you an example, the typical particulate matter concentration in New York City would be on the order of 10 to 20 micrograms per cubic meter, but there were several days in a row where it was 200 or above. So factors of 10 higher, and levels that just hadn't been seen in decades in these regions of the East Coast. In the 1970s and 60s and 50s, actually probably were often at those levels. And so that just shows you the dramatic improvements that have been made in regulating and improving air quality over time by enacting all of these different regulatory controls. We have actually made the air cleaner. It's just that with now this onset of more frequent and larger wildfires, some of that progress is being eroded.
And I mean, the root cause of these wildfires is obviously increase in the in a heated climate, right? Climate change, the fact that
there's many factors. Yeah.
Right.
So climate change is definitely one. It primes the system for more severe burning. It tends to have warmer temperatures, and then the fuels dry out faster, and so they're just ready to burn. But then there's, of course, human encroachment and changing fire suppression practices over time that have sort of all culminated to this period of just being in a situation ripe for large wildfires.
And is this, I know that there were massive wildfires in Europe as well. What were some of the effects that they experienced?
Yeah, it's, again, climate change is a global problem, and so are practices related to fire suppression and encroachment on ecosystems. There's also intentional burning that we could even talk about for the people of Brazil or Africa, where large-scale burning is done to clear land for agriculture, and that's equally a problem for exposure to particulate matter as well. Whereas wildfires are more not intentionally caused, or they're caused by a lightning strike, and then the system just erupts into fire, and they sort of can't be controlled or regulated. In Europe, so the fires in Greece, for example, were catastrophic, and that smoke has the same impact. No matter where it's produced, it's going to degrade air quality and be transported to downwind regions in Europe. And then those were all components of increasing in air pollution and degrading air quality that the IQAir report sort of alluded to, that there was actually air pollution was not really improving at a rate that we would like between the past year, 2022, and 2023, in part because of these wildfires that were happening, not just in North America, but really across Europe and Eurasia.
What are some of the health effects from people being exposed to air that has particulate matter in it due to wildfires?
So the health effects of specific types of particulate matter are not as well understood as just exposure to particulate matter generally. And so that's a sort of active research area, is trying to understand which types of particulate matter are the most problematic for health. But in general, there's sort of two ways to think about the health effects. One is the short-term sort of acute response to breathing in highly polluted air with particulate matter. These tend to be associated with respiratory problems, inducing asthma attacks, or even inducing cardiovascular, so heart problems, and then increasing hospitalization as a result, and even can go into cardiac arrest and death. So it's certainly sensitive individuals that already sort of have asthma or emphysema, they're going to experience the effects earlier than someone without those conditions. But we're all sort of going to experience them. The higher the particulate matter concentrations are, you might start to feel your throat being irritated, coughing a lot more, and those are the conditions that sort of are acute and sort of in the short term. And then there's the more chronic long-term exposure to particulate matter, where much lower concentrations of particulate matter have been observed to, over the long term, to lead to negative health outcomes, especially premature death is the one that's most commonly found. So when you take into account all the other risk factors, there's an amazingly linear correlation between risk of premature death and exposure to particulate matter. So the amount that you're exposed to increases your risk of premature death by a few percent every 10 micrograms per cubic meter that you're exposed to over many years. And so there's been really some fascinating studies that compare different cities and the same cities over time as the pollution is changing over time, and in finding this strong relationship between exposure to particulate matter and premature death. And the causes of death are usually related to cardiovascular disease, so respiratory effects as well, and then lung cancer, for example. Things that are actually somewhat fascinating and disturbing is that cognitive function is now related to, so declining cognitive function is now related to exposure to particulate matter. Early onset dementia. So students do poorly on tests in under polluted conditions compared to cleaner conditions. And this is specifically just exposure to particulate matter. There's a type of particulate matter ultrafine. So we talk about PM 2.5. These are particles that are smaller than 2.5 microns. You might not know what 2.5 microns looks like. The cross section of a human hair, if you measure the diameter of your hair, that's about 50 to 100 microns. So we're talking about very small particles. And you get down to 100 nanometers or smaller particles. These can actually cross into the bloodstream and actually enter the brain through the olfactory nerves. And so there's now concerns that exposure to ultrafine particles are partly responsible for especially degradation in cognitive function. And I think we're really just scratching the surface in terms of what the full health impacts are of exposure to particulate matter.
That is very well said and helpful to understand. When I see numbers like 7 to 8 million people die every year due to air pollution, what is your assessment of those figures?
So those are based on these epidemiological studies where they have found relationships between the risk of premature death, so the mortality rate ratio. So this is how often death is occurring when you take into account all of the other factors that's correlated with exposure to particulate matter. And so taking then these types of measurements that the IQAir report provides in terms of amount of particulate matter in any region and the number of years that people living in those regions are exposed to those concentrations, then they can estimate the number of premature deaths per year. And so it's a pretty strong foundation of science that those numbers are based on. So they're probably pretty reasonable. The numbers you might hear vary in part due to whether or not it's premature death due to exposure to particulate matter or to other toxic gases like ozone, or the combination of the two. And so all of them have slightly different impacts on life expectancy. And so you might hear 3 to 4 million per year die premature deaths due to exposure to particulate matter. And the 7 to 8 million is more the sort of full combined effects of air pollution are leading to 7 to 8 million deaths per year around the world. And that's just, taking these sort of rates of premature death that can be attributed to pollutants like particulate matter from long-term cohort studies, they're called, following people through time and monitoring their exposure to particulate matter or other pollutants, and then documenting when they die and what they died of, and seeing what the causality they can impart to particulate matter. And that's been done since the 1990s, those types of studies. And each study always comes back with a confirmation that particulate matter exposure leads to premature death.
And are these deaths more highly concentrated in the global south or in regions where there's, less wealth, less regulation, that kind of thing?
Right. It's really going to be where particulate matter concentrations are highest. And certainly in regions where the regulations are not enforced or not as strict, or the economy is not such that there's higher efficiency sources of fuel or filtration, then exposure will be higher. And especially in developing world nations and communities, often indoor air quality is just as bad or worse because of the way that home heating occurs or cooking is taking place. You don't have fancy hoods to try to move all of the particulate matter out of the household when they're burning over an open wood stove, and so that type of exposure is factored into some of these studies, but it's important to start, I think in the future, start separating, is it air pollution from motor vehicles, energy production like coal-fired power plants, or exposure indoors that is related to residential living and the needs of eating and heating one's own household. And so there's been large efforts to help improve those situations by providing clean cooking stoves and or more efficient home heating units in these developing world nations to better improve air quality in the homes, as well as obviously what is done in the homes often ends up in the air. And so it's this sort of combination of just inefficient burning often. And that can be for heating, cooking, or waste removal. These end up in very populated countries or regions being the biggest sources of exposure to pollution. And yes, so when the particulate matter concentration is highest, that's where we're going to expect the highest rates of premature death.
Well, Joel, really appreciate your time today. Thank you so much for taking the time to explain this to us, Professor of Atmospheric Science at University of Washington. Really appreciate you coming on the show. Thanks so much.
Oh, thank you. It's my pleasure.